You're listening to Health Professional Radio. This is eHealth, our regular look at what's happening with technology in information management in the health sector. And my guest today is Dr. Marcus Tan. Marcus joins us from Australia, where he is the founder and CEO and medical director of HealthEngine. Marcus, I was sent a press release recently that attributed to you the statement that the Australian healthcare system is fragmented, archaic, and at risk of being left behind. That's a pretty strong statement. What leads you to that?
Wayne, look, I think it's probably fair to say, and look, I'm a GP by background, and I've been practicing for around 20 years now. And look, Australia's health system by far ranks as one of the best health systems in the world as far as clinical outcomes and other things. The problem is that if you've ever been a patient in that system, you'll know that it's actually the experience of that healthcare system is quite poor in the sense that it's quite fragmented. The communication's quite bad. Information doesn't get shared easily. And so, that can obviously lead to lots of, of bad things happening or poor consequences. And so, I think sometimes the outcomes might be good, but the experience of it isn't so good. And I think that's not in dispute, actually. The fact that we still have fax machines and some of these sort of old-fashioned sort of technologies that nobody else uses anymore is a good example of that.
Now, we've had eHealth in Australia for, 10 years. The federal government has their My Health Record program. Various independent providers, Google for a little while and Microsoft for a while, have had various electronic health records. Why hasn't it been adopted, and why isn't it just now smooth and as efficient as doing online banking?
Well, I think it's largely a couple of things. I think that sometimes the technology is a little bit too ahead of, what the actual market's willing to wear. And clearly the market in healthcare tends to be a little bit more conservative. People don't want to adopt new things largely because the tried and true has been shown to be safe, or at least, has shown to work, albeit it's a little bit clunky, but it's better than what you don't know. And so sometimes you stick with the devil that you do know. And new technologies can often introduce unintended consequences and things that people don't fully appreciate. And so, the risk adversity, I think, doesn't help the healthcare system in that sense. And of course, if you get it wrong, people could potentially die and so on. So I think that's it's probably fair enough. In saying that, some of the technologies are slowly getting developed, and you've got to be able to see value on both sides. So a lot of things like records, if you don't have good data in there and you don't get utility out of that data, then the patients themselves don't get the value, and the providers who access that data also don't get the value. And so therefore the adoptions, it becomes very easy to get cynical about new technologies and how they don't really add any value to your life. So it's not surprising, but I think, things have got to change because obviously consumer expectations are also changing around what they want to see out of their services. And healthcare should be not really any different in the way that they address some of those issues.
Now, it might just be an urban myth, but the story goes that 150 years ago, it took 30 years for doctors to widely adopt the practice of washing their hands. Is it just a reluctance on the part of the medical profession to accept new things?
No, I don't think so. I think, healthcare, as you know, is on the forefront of a lot of cutting-edge technology. And you'll find that on the therapeutic side particularly, there's always a lot of, new innovative work happening, lots of medical research and medical devices, new drug discoveries, all those sorts of things that you hear about that, that makes us, very progressive and increases our life expectancies. I think where it becomes difficult is in just the workflows that people sort of start to conduct their business. And so, when you're a doctor and you're used to being booked up to the hilt and, having waiting rooms full of people, and that's how you've kind of run your business for a long, long time, actually changing, the actual change is the hard part. Not the idea of the change, it's just more the actual change. So, what are the tools that you're going to be able to use to actually make things easier? And sometimes it is, as I said, easier to stick with the tried and true. And, hence people will end up using paper because they're not very good at typing. And so, having to learn to type is hard. These are the sorts of little things that just are little impediments that make stuff a little bit harder. That's all. So I'm not sure that they're not open to change. It's just that they just don't necessarily have the tools to do that.
You're listening to Health Professional Radio. My name is Wayne Bucklar, and I'm in conversation with Dr. Marcus Tan. Marcus is the founder and CEO and medical director of HealthEngine, and we've been talking about change in technology in the health sector. Marcus, for people who are not familiar with HealthEngine, can you fill us in on what it is and what it does?
Yeah, sure. So HealthEngine was started, I mean, as I said, my background is as GP, and we, as GPs end up sometimes being the gatekeepers to all sorts of, issues that we see in the health system and the inefficiencies of the health system. And for us, certainly for me, having worked in the health reform space, involved with various health bodies to try and improve healthcare, I saw the use of technology to be able to improve some of the inefficiencies that I saw. So I started with two developers in my lounge room, and HealthEngine is now one of the largest providers of technology tools for health providers to better connect with their patients. We have around about 130 staff now. And what we did was we basically pioneered the mass usage of online booking technology by health providers in Australia. And we currently service around about 4,500 clinics around the country, and about over 2,000 of those are GP clinics, and the rest being dental, allied, and specialist type of clinics. And aside from online bookings now, we've also we also have tools like recall systems and reminder systems and those sorts of things that are communications tools that help practices, engage with their patients. And we also provide services that help practices grow, so attract new patients and so on. I think the thing that actually distinguishes us, though, is that on top of those sorts of services that are direct to providers, we also have a free app and website that's used by over 1.5 million people a month to manage their healthcare. Now, what that does is that it incorporates the management of their bookings with their existing providers. It also helps them find new providers if they need to. It helps them manage their medications. And as you just mentioned, we were actually recently one of the 4 organisations chosen to link with the government's My Health record, which means that patients can now access the centralised record through the HealthEngine app.
Now, Marcus, what about beyond the private practitioner? Is HealthEngine something that can be used if you're accessing those government-run clinics and public health system clinics? Is it a tool that could be used in those spaces for appointments and bookings?
Yeah, it's certainly on our roadmap. I mean, the private health system, or at least the community-based primary care system, is where we've tended to focus largely because, as I said, because I'm a GP, I tend to see, we have the largest volume of patients that comes through general practice. And so because we're trying to help the largest number of people currently, we've been focusing much more on GP, but as I said, we've expanded into dental and other allied and specialists in the community. But certainly the public hospital systems and those types of government-run services are on the roadmap that we'd like to connect with.
And certainly the administrative cost of running a practice is part of the overall cost of healthcare. Whichever way you look at it, a dollar is a dollar, and it's still coming out of the government bucket somewhere along the line. So anything that makes that more efficient is going to leave more dollars behind, I guess, for actual clinical care.
Yeah, absolutely. It was interesting. I was just reading an article the other day where the lack of interoperability, which is the sort of term that we use in the industry around apps and software actually connecting with each other to be able to share information. The lack of it and the fragmentation within just the software industry is actually costing practices something like $50,000 a year, right? Like, and this is the sort of stuff that, is mostly just around just loss of time, just, inefficiency, waiting for things and having to call around and, the sort of stuff that if you just reduce some of that friction would actually make life a lot more pleasant and also a lot more affordable.
Marcus, it's a fascinating topic. For people who have been listening to you and are keen to continue the conversation with you or get hold of you, is there a website they can visit, or how do they get in touch?
Yeah, well, the HealthEngine website is just www.healthengine.com.au. There is a segment of the website that if you're a practice or a health provider, that will cater to some of your information needs. But contacting the company through the contact number is also the other option.
It's been a pleasure chatting with you today, and I do appreciate your time. I realise you're a busy man.
You're very welcome, Wayne. It's been a pleasure.
Now, if you've just joined us on Health Professional Radio, you've just missed an interesting conversation I've just had with Dr. Marcus Tan, the founder and medical director, CEO of HealthEngine. The good news is, on our website we have a transcript of the conversation. You can also access an audio archive on SoundCloud and on iTunes or at www.hpr.fm. This is Health Professional Radio. Thank you for being with us today. My name's Wayne Bucklar.